How are you guys doing today? I'll be Nurse Shelby, and I'm here to be taking care of you today. How are you feeling?
Not too great.
Okay. Can you start off with your name and date of birth for me?
My name's Dayana Johnson. I was born June 5th, 2007.
Okay. And do you have any allergies?
I have seasonal allergies. I also have asthma.
Okay. Are you taking anything for those?
For my seasonal allergies, I take like Zyrtex about once a day. And then for asthma, I have an inhaler that I take usually before my basketball games and after.
Okay. And do you know possibly what type of inhaler it is?
I think it's
albuterol. She takes albuterol, yes.
Okay. You said that you have some pain in your head. Could you tell me like what type of pain it is, or in 0 to 10?
About a week ago, while I was playing basketball, I got a concussion, and it just hasn't gone away. And it's just really bad. It's throbbing, aching. It's like 11.
Okay. Have you been taking anything for that pain?
I've been taking 3 aspirins 3 times a day.
Yes, take aspirin. We have the bottle here if you need to see it.
Okay, this is 325 milligrams. So you say you've been taking 3 of these 3 times a day?
Yeah.
Okay. What we're going to do is we're going to call your provider. We're going to see about some tests for you. We're going to see because this is a high dose of aspirin that you are taking.
Is there something wrong with that?
Yeah, so we definitely don't want you to be taking that much aspirin every day. And do you know, are you using anything else in combination with it? It could be supplements, energy drinks, anything.
Goddamn energy drinks.
Yeah, I drink like 2 Celsius a day.
2 Celsius.
So I have a lot of schoolwork. I'm in the student union, my basketball. I'm a junior.
Okay.
Started playing colleges. Is that bad?
So yes, we definitely don't want to be doing that much caffeine and this much aspirin that you're taking. And since you are doing a sport and you're exerting yourself, we do want you to kind of lower the amount of exercise you're doing. We want to make you get better. So
I can't stop playing basketball.
Yeah, what about her pain if she can't take the aspirin? I do have back pain. I've been prescribed this drug for my pain. It's like
hydrocodone?
Yes. So can I just give that to her? Because it really helps my pain, so wouldn't it just help hers at this point?
So we definitely don't want any type of sharing of medication, especially something as aggressive as an opioid. We definitely do not want to be sharing any of that. I understand it's very hard to see your daughter in pain, but we do not want to be sharing any of that medication, especially with her asthma that she has that can lead to some very severe side effects.
Okay.
So I'm gonna call your provider. We're gonna, see what we can do. I'm just gonna check your vitals here really quickly and make sure those are okay. So it just seems that your heart rate and your blood pressure are a bit elevated, but that could be due to your pain that you just described. I'm gonna talk to her and see what we can order. Do you have any questions for me before I go?
No.
Okay, I'll see you guys in a bit. Hi, good morning, Dr. Stockschlater. It's Nurse Shelby. I'm calling regarding Dayana Johnson. So she came in with 10 out of 10 pain after suffering a concussion after playing basketball. She's been taking 325 milligrams, 3 of those aspirins per 3 times a day. And she has also been taking her Zyrtec, and she also has a albuterol inhaler that she takes.
All right, let me pull up her chart really quick. What was her pain level again?
She said it was like an 11 out of 10.
11 out of 10?
Yeah.
And is the aspirin helping her at all?
No, she said that she's still experiencing that pain with taking all that aspirin.
Okay, and then what about her albuterol? How often is she taking that?
Every 4 to 6 hours as needed.
All right, we're definitely gonna stop that as well. All right.
And she also said that she drinks about 2 Celsiuses, 2 of those energy drinks a day. So there's about 200 milligrams in every Celsius, so that's about 400 a day.
Yeah. So she's gonna have to limit that. Max for caffeine is 200 milligrams. So definitely limit that. That's definitely not helping her headache. Is she taking it easy with her concussion?
She said she's been limiting her exercise lately.
That's good.
But she does seem very anxious to get back and playing basketball again.
All right. Here. So we're definitely gonna stop the aspirin. A, because it's not helping her, and B, she's taking too much. We don't want it. Like, that's really hard on her liver and kidneys, especially at her age. We're definitely gonna stop the aspirin. I'm gonna want to do some renal and liver, a CBC, before I say anything else to maybe help with the pain, but her best bet might be Tylenol. And I'm also gonna get her a fluticasone steroid, fluticasone, twice a day, just for as a maintenance drug. I'm gonna keep her on albuterol, but this is more of a maintenance drug. And keep up with the light activity. Do you think there's anything else that we really need to be concerned with her?
I would just say mostly that aspirin, and her dad did suggest giving her his hydrocodone, but I told him there's no sharing.
Alright, good, yes. Definitely no sharing, and like I said, we're gonna stop the aspirin. And then do that other function test before we decide anything else. And then once she does start her steroid, make sure she comes back in 2 weeks to make sure it's working properly. Other than that, I don't have anything else if you don't.
Oh, sounds good.
Alright, perfect. Have a good day.
You too. Hi, you guys. I'm back. I just finished speaking with the provider, and she did tell me about that aspirin. She definitely wants you to stop that aspirin and limit your caffeine. She did change that albuterol to a more long-term inhaler. That one you have to take a morning and night, so twice a day, and make sure you rinse your mouth out after, just to make sure we're not getting any thrush because of that leftover medication in your mouth.
What is thrush?
So that can be a buildup of yeast in your mouth caused by that steroid, so you just want to make sure you're rinsing that out. What you are doing good is that you're resting yourself, you're listening to your body when you do need that inhaler, so that steroid will last longer. She does want to keep you on that albuterol just in case you feel like you do need it after, exertion, but more so stay on that fluticasone that she's going to give you. So like I said, limit the energy drinks, and we're going to do some liver, kidney function tests, and we're going to do some blood tests just to make sure your body is
Something's
working.
wrong with her liver and kidneys?
Well, because the amount of aspirin that she has been taking, we just want to make sure her body is working correctly before we do prescribe another pain medication. But your best bet will probably be Tylenol. So we're just going to make sure your body's functioning correctly before we do prescribe that, okay? Do you have any questions for me?
Have any questions? Basketball, nothing? Okay.
Can I still play basketball?
So we just want to lower the amount of activity. So once you take that inhaler, we just want to make sure your body can handle that. So continue taking that Zyrtec, continue taking that long-term inhaler, and do try to limit the amount because we do want your body to heal first. So just limit until you come back a week after to make sure everything, that fluticasone is working correctly, and then we can see about maybe changing the amount of activity you're allowed to have. Okay?
Okay.
That sound good?
Thank you.
It's also just like recording long enough to like.
Baby, when you walk away.